Imagine waking up one day and realizing the world has slowly dimmed around you. Colors seem muted, words blur on a page, driving at night feels daunting. For millions of seniors, this isn't imagination, it's reality. The cause? Cataracts. Cataracts are one of the most common vision problems affecting older adults. They occur when the lens of the eye becomes cloudy, leading to blurry vision, dull colors, and increased sensitivity to light. By the age of 80, more than half of all Americans either have a cataract or have had cataract surgery. It's a natural part of aging, but the good news is, it's treatable. As we age, proteins in the lens begin to break down and clump together, forming cloudy patches. Over time, this cloudiness worsens, making daily activities like reading, driving, or recognizing faces difficult. Cataracts usually develop slowly, and at first, you may not notice the changes. But when vision starts to affect your daily life, like reading, driving, or moving around safely, it might be time to consider surgery. At Caring Senior Service, we help seniors with these challenges every day. We've seen how cataract surgery can make a big difference, helping older adults feel safer, more independent, and more connected to the world around them. It's a small step that often leads to a big improvement in quality of life. You might be wondering, is cataract surgery really safe for someone my age or my parents' age? The short answer is yes. Cataract surgery is considered one of the safest and most effective surgeries performed today. According to the National Eye Institute and numerous medical studies, cataract surgery has a success rate of over 98% in otherwise healthy individuals. More than 3.8 million cataract surgeries are performed each year in the US. The risk of serious complications is less than 1%. Even for seniors over the age of 80 or 90, the procedure is low risk and typically done without general anesthesia, which is a major advantage for older adults. Let's walk through what actually happens during cataract surgery. Step 1, preparation. The eye is numbed with local anesthetic, either eye drops or an injection. You'll be awake but relaxed. Step 2, small incision. The surgeon makes a tiny incision on the side of your cornea. Step 3, ultrasound breakup. A small probe uses ultrasound waves to break up the cloudy lens. Step 4, lens removal and replacement. The pieces of the cloudy lens are suctioned out and replaced with a clear artificial intraocular lens, IOL. Step 5, recovery. No stitches are usually required, and the whole process takes about 10 to 15 minutes per eye. Most people go home the same day, often with a dramatic improvement in vision within 24 to 48 hours. Let's address some of the most common concerns seniors or their families have about cataract surgery. Concern number 1, I'm too old for surgery. Not true. Age by itself isn't a reason to rule out surgery. What matters more is your overall health. In fact, seniors over 85 have the same success rates as younger seniors, provided they are otherwise in stable health. Concern number 2, what if I can't stay still? Most patients are lightly sedated to help them relax, and the procedure is incredibly fast. Staying still isn't as hard as you might think. Concern number 3, will I feel pain? Cataract surgery is painless. You might feel slight pressure, but that's about it. Concern number 4, what if I have other health conditions? If you have chronic conditions like diabetes, high blood pressure, or heart disease, your surgeon will coordinate with your primary care provider. Pre-surgical assessments are done to ensure safety. While cataract surgery is extremely safe, no surgery is completely without risk. The most common side effects are temporary and include blurry vision for a few days, mild discomfort or dryness, sensitivity to light. Rare but serious complications can include infection, called endophthalmitis, retinal detachment, swelling of the retina or cornea, increased eye pressure, glaucoma. However, the risk of any of these occurring is less than 1 in 1,000 for healthy individuals, and early treatment typically prevents long-term damage. Recovery from cataract surgery is relatively quick and simple, especially when compared to other surgical procedures. Most seniors experience significant improvement in vision within 24 to 72 hours, full recovery in about 4 to 6 weeks. Minimal restrictions. though avoiding rubbing the eye, bending over, or lifting heavy objects is recommended early on. Follow-up appointments are crucial to ensure the eye is healing correctly. You'll likely use prescription eye drops to prevent infection and inflammation. This quick recovery often leads to improved independence, confidence, and overall quality of life. For seniors, cataract surgery offers more than just better vision. It can change the way they experience life. Benefits include reduced fall risk. Clearer vision improves balance and depth perception. Better mental health. Being able to drive, read, or watch TV can ease anxiety and depression. Greater independence. Many seniors resume activities they had given up, like cooking, gardening, or socializing. Studies have even shown that cataract surgery is linked to longer life expectancy in older adults. Why? Because vision is so closely tied to mobility, safety, and emotional well-being. You may be wondering about the financial side of cataract surgery. In the US, Medicare typically covers the cost of standard cataract surgery, including the surgical procedure, pre- and post-op appointments, a basic intraocular lens, IOL. However, if you choose a premium lens, like multifocal or toric lenses for astigmatism, you may have to pay the difference out of pocket. Most seniors pay very little, if anything, for their cataract surgery when using Medicare or supplemental insurance plans. If you or a loved one is preparing for cataract surgery, here are a few tips. Ask questions. Make sure you understand what type of lens will be used and what vision you can expect afterward. Arrange transportation. You won't be able to drive yourself home the day of surgery. Follow pre-surgery instructions. Your doctor may ask you to avoid food or adjust medications. Line up help at home. You may need help with meals or tasks for a day or two. Attend all follow-ups. This ensures optimal healing and early detection of any issues. Cataract surgery is more than a medical procedure. For seniors, it's a second chance to see clearly, to feel safe, to reconnect with the world around them. It's one of the few interventions in healthcare that is quick, highly effective, and low risk, with enormous returns on quality of life. So if you or someone you love is living with cataracts, don't let fear or uncertainty hold you back. Talk to an eye doctor, ask questions, explore your options. And if you're a caregiver or family member helping a loved one through cataract surgery, we'd love to hear how you're supporting them. Leave a comment below.